Well, hello everyone, and I want to welcome you to part 2 of 4 of the Critical Access Hospital CMS Conditions of Participation. If you were fortunate enough to listen in on the first section, we're just going to be making a continuation of the entire manual. So for this session in particular, we're going to be talking about the physical plant, the environment. That's environment of care. We're going to talk emergency preparedness. CMS made some major changes over the last couple years. In fact, there was one just last year that dealt with emerging infectious diseases. We're going to talk the governing board, telemedicine, highly used in critical access hospitals. And in fact, there was a report that came out just recently in the Medical World News that said Medicare telehealth jumped up to over 52 million visits in 2020. That's up from 829,000 for the year before. Was it COVID impacted? Most likely. But again, telehealth skyrocketed. And then pharmacy and dietary to wrap it out. So let's go ahead and get started. Why are we here? Well, of course, so you don't get one of these. That is the statement of deficiencies and plan of correction. That's when they've come through, done their survey, and then you have to do something in response. How do you keep up with the changes? What are you supposed to do? Overall, subscribe, this is just a recommendation, but subscribe to the Federal Register. The manual itself, the conditions of participation, the manual, State Operations Manual, it was first published back in 1986. Of course, multiple updates since then. It's split out into sections. That's how they identify a particular item that CMS may cite you on, called tag numbers. Here is the appendix for the entire manual, and it covers every type of care or service. Survey memos, that's that survey and certification. This is where they send out the policy and memos for the surveyors. So here are the topics we're covering today. I've tried to include it as much as possible in this particular slide. So let's start right off with the first topic, physical plant and environment. Your hospital, the four walls, what's going on around it and how do you supply it? So it talks about construction. And by the way, the tag numbers, I put them up in the upper right-hand corner. If you don't see a tag number, it's because it's a continuation of the previous tag number that was listed. Construction. It has to be constructed, set up, and maintained so that people can get in, that you ensure access. Maintenance. You are required for housekeeping, that's environmental services, and preventive maintenance programs. Again, this is very broad when it talks about equipment. That includes boilers, elevators, ventilators, x-ray. Again, anything that's a piece of equipment, we have to keep it in working order. You are expected to have a list of all your equipment that is essential to your operation. Well, let's move on to disposal of trash. Trash is part of our environment. As far as storage of drugs, I'm not talking administration, storage of your medication, drugs and biologics. On the physical environment, it needs to be clean. As far as ventilation, lighting, temperature, you have to make sure there is proper of all three. Same with our sprinkler system. Again, these are new, and CMS has not come around with some guidelines for us. Now, CMS can consider any recommendation from your state survey agency or AO, that's like Joint Commission, DNV. All right, now I'm going to show you emergency preparedness. Emergency preparedness, they moved the major requirements, each and every one of them, to Appendix Z. Now, Appendix Z is for everybody. Your plan must be reviewed and updated every 2 years. Your communication plan, again, the plan that complies with all laws, state, local, federal, and don't forget tribal. And again, reviewed and update every 2 years. You have to do training and testing, and you have to develop and maintain that program. Testing. You are testing your emergency preparedness system. Power systems, you have to put together emergency and standby systems. Generator, that's up to you. Let's go over to our organizational structure. Who's our governing body, or also known as the board? Someone who has assumed legal responsibility to implement and to monitor your policy and procedures. The criteria to collect for selection of the staff. Well, let's move over to disclosure. All right, let's switch over now to staffing and what their responsibilities are. This is professional staff, physicians, other providers, because it can be physicians or mid-levels. So that's staffing. What about responsibilities? Let's start with the physician. They do provide medical direction, supervision of staff. Now, as far as patient admission, now CMS says that Medicare and Medicaid patients must be under the care of a physician. And now I'm going to start on provision of services. As I mentioned, this was a major component of the critical access hospitals. You have to establish a requirement that talk about patient care policy on your required services, or if it's through an arrangement or an agreement, in other words, a written contract. These are the ones that we're going to talk about in particular. Scope of services, emergency services, referrals, drugs, biologicals, food and nutrition, and procedures, emergency procedure. Drugs and biologicals still under the provision of services. So for drugs and biologicals, that's how CMS calls them. By the way, Joint Commission deemed status, they call them medications. For drugs and biologicals, your policies must include how you're going to store them, how and who can handle them, how you and who can dispense them, who is going to administer them. Handling, that means you're mixing them, reconstituting the medication. Now, compounding drugs. There is the Drug Quality and Security Act, and it talks and has sections on compounding. ISMP, ASHP, they talked about sterile compounding. When you're talking about dispensing drugs and biologicals, not administration, dispensing, labeling. Each individual drug has to be labeled. A medication error is usually a preventable event that can lead to inappropriate use or patient harm. They do mention in here in the actual conditions about that non-punitive environment. It's also known as just culture. Now, dietary. Let's talk about those things for a while. Policies, you review them at least every 2 years. So I'm going to go ahead and close it out. I do want to show you, here's the appendix and resources for you. I have included some of the new notices. They did provide us a crosswalk because a couple years ago they renumbered the critical access numbers. But in this document, this is on slide number 147. As you filter down, like I said, it's like 600 some odd pages. You get down to 590 and you're going to start seeing some of those new tag numbers for critical access hospitals. That's how you find them. That happens to be the hospital design guide that I had talked about, hospital equipment maintenance and equipment memo, COVID reporting. That's the survey memo on COVID reporting, what we have to report. Some of those have changed over time on what we're mandatorily to report. Thank you everyone for attending. And with that, we'll go ahead and close out the webinar. Thank you.